Good morning, friends. Many patients from across the world are planning to come to me for penile implant surgery, but they are anxious about the whole process. Would it be safe to travel to India? Would the treatment they receive be world class? Where would they be staying after the treatment? I am Dr. Ashish Sabharwal, urologist, andrologist and robotic surgeon from New Delhi, India. In this video, I will give you full details about the preparation before penile implant surgery and how we assure that the patients who come to us have a great experience. First of all, we will discuss about the travel. So my center is located in New Delhi, India. New Delhi is the capital of India and it has a major international airport, the Indira Gandhi International Airport. It has major connectivity with all the major airports of the world. So you can most of the time get a direct flight from your country and come to us for the treatment. Many patients are coming from outside Delhi but within India. So even they can find a direct flight from their city to New Delhi or a train from their city to the New Delhi. So travel is not a problem. For patients traveling from outside India, and if you are not an Indian citizen, then to travel to India you will need a medical visa. We will assist you in getting the medical visa. You have to send your passport and your email address. Once we receive the passport and the email address, we will send you a visa letter to you and to the embassy. And you have to go to the Indian embassy in your country and apply for the Indian visa. Once you have the Indian visa, then you can plan to travel. After you get the visa, the next step is that you book your tickets. The arrival destination is Indira Gandhi International Airport, New Delhi. And once you have booked your tickets, you can send the tickets by WhatsApp and we will arrange the airport pickup. It is very easy to communicate with me directly. I have a single WhatsApp number that is +91 9999059016 and you can message me on this number, and whenever I am free I will try to reply to you as soon as possible. Another thing which my patients are concerned about is the stay. So regarding the hospital stay, since you are coming from outside India, to make your stay comfortable, for all the patients who come, we give a private room with complimentary Wi-Fi which is available 24 hours. Regarding the hotel stay after discharge from the hospital, so there are many hotels even in walking distance from the hospital. The budget of the hotels is from $30 per day onwards, depending on the category of room you decide. The next issue is the connectivity. So we have 4G and Wi-Fi available both in the hospital as well as in the hotels. So you should not have any problem. Apart from that, as soon as you arrive, our team will help you get a SIM card so that you can make your mobile active as soon as possible. To travel within the city, you have the Uber app which is available 24 hours at the click of a button. After coming to India, we recommend that you stay in Delhi for at least 5 days after your penile implant surgery to ensure full recovery. Apart from this, I recommend that you discuss your problem in detail with me on WhatsApp so that we know exactly what you're coming for and you also know it and there are no surprises. Just for guiding you, I will discuss a few points regarding your penile implant surgery and other things which you have to take care of. The first issue which the people get confused is about the penile size. So I will tell you that penile implant is for erectile dysfunction treatment. It does not increase the penile size. After implant, your penile size will be equal to the maximum erect length which you have currently. We always aim to maximize the penile size at the time of penile implant surgery. To do that, we recommend the patients to start tadalafil once daily for at least 1 month before the surgery, and also use vacuum therapy to increase the blood supply to the penis so that the penis becomes soft, the tissues become soft and we are able to dilate properly and we give the maximum penile size. The second thing is a webbed scrotum. Many patients have a webbed scrotum. What the webbed scrotum means is that if this is the penis, the scrotum is reaching almost up to the tip of the penis. So what the webbed scrotum does is it reduces the penile length. So we can reduce the webbed scrotum and pull it backwards so that the penile length increases. But you have to inform us before the surgery so that we are aware that you have this problem and we can treat it at the same time of penile implant surgery. The third thing is phimosis. Many patients have phimosis or tight foreskin, and for best results I recommend that you do the circumcision along with the penile implant surgery. That way both the things will be treated at the same time. The fourth thing is the penile curvature. Many patients, especially after the age of 50, they develop Peyronie's disease and a penile curvature along with erectile dysfunction, and they think that once the implant is put, the penis will become straight, but this is not true. if you put an implant in a curved penis, even after implant, the penis will stay curved. So to make the curved penis straight, along with penile implant, we have to do plication surgery or plaque excision with grafting. So if the patient can inform us before about the curvature, we can plan these procedures along with the implant surgery. It has happened many times that when we do the artificial erection at the time of surgery, we see that there is a significant curvature and patient has never informed us before about this problem. So I always recommend that you should inform us about the curvature before the surgery so that we can plan to treat that at the same time. The fifth issue is the prostate issues or weak urinary stream. Many patients who are having erectile dysfunction, they also have a urinary stricture or enlargement of the prostate. So if you have prostate enlargement or stricture disease, those things have to be treated before the implant surgery. The sixth issue is that you inform us if you have had a previous abdominal surgery. This is especially important for 3-piece inflatable implant. The seventh and very important issue is about diabetes. Many patients are diabetic along with erectile dysfunction problem, and when they come to me, their sugar is not controlled at all. So we cannot do the implant surgery immediately. We have to admit the patient for a few days. That wastes their time, it wastes extra money. I always recommend the patient that if you are having diabetes and you're planning to come for penile implant surgery, best to first visit a diabetic doctor, control your sugar. The target sugar is less than 200 milligram per deciliter, empty stomach as well as 2 hours after food. And if the sugar is less than 200, only then you should come for penile implant surgery. That way we can admit you the day you come and do your surgery immediately. That will save your time and it will save your money. The eighth issue is about any skin infections or urine infection. If you have any skin infection or urine infection, that has to be treated before with antibiotics, antifungals, and only when these infections are treated, only then we can do the penile implant surgery. So now, considering that you have seen this video before and you are in constant touch with me, once your dates are finalized, please inform us at least 1 week before the exact date of arrival, so that we can arrange your airport pickup and also book you in for the theatre. Secondly, we have to start you on antibiotic prophylaxis 3 days before the implant surgery. So we will advise you how to take bath and about the antibiotics you have to take before coming, at least 3 days before coming. Third thing, if you're taking Ecosprin or any blood thinners, you have to stop these things 5 days prior to the surgery. Finally, when you're coming for your penile implant surgery, plan your stay in Delhi for at least 3 to 5 days. Regarding the clothing, get loose clothes and tight underwear so that you are comfortable after the penile implant surgery. So friends, I hope you liked this video. If you are also thinking of penile implant surgery, you can contact me on email or WhatsApp. My email address and WhatsApp number are given in the description. Thank you.